Have you noticed your erections aren't as solid as they once were? Maybe you blame it on testosterone or blood flow, and those matter, but there's an important piece most men miss. The pelvic floor, those hidden muscles are the ones that literally hold blood in the penis and help you stay hard. Like any muscle, they weaken if you stop training them. The good news, they respond really well to exercises even later in life. I'm Dr. Hana Kim. Today, I'll walk you through 5 powerful Keela-based moves you can do at home with no equipment. They improve firmness, control, and even bladder health. Stick with me through the whole routine. The last move is the one most guys skip, and it's the real game changer. Before we start, find a comfortable spot and give yourself permission to focus on this for a few minutes. Consistency beats intensity. 5 to 10 minutes a day will get you better results than one long, awkward session once in a while. Begin by lying on your back with your knees bent at about a 45-degree angle, feet flat and hip width apart. Rest your arms at your sides with palms down so your body feels stable and relaxed. Take a few slow breaths in through your nose, out through your mouth just to settle in. Bring your attention to your lower back and lower belly. Gently brace your core by drawing your belly button in toward your spine and press the small of your back into the floor as if you're smoothing out the gap underneath. Tilt your pelvis a touch upward until you feel a mild activation in your lower abdominal and pelvic muscles. Don't strain. The feeling should be subtle but definite. That's your baseline. This is a foundational move. It connects your deep abs to your pelvic floor. So both work together. Hold the tilt and contraction for 3 to 5 seconds at first, breathing steadily through your nose. Then release with control. Why it helps, you're training co-contraction. The pelvic floor and lower abs firing together, which improves the muscles that lock blood inside the penis during erection. Think of it as building a stronger, more responsive inner corette. How to progress? Start with 10 to 15 reps. Quality over quantity? As you get stronger, work up to 20 to 25 reps. Focus on clean movement and full breathing. Over weeks, you'll notice better control and a greater sense of locking firmness when needed. Lie face down on a mat with legs extended and forearms flat on the floor under your shoulders. Gently lift your chest a little. Think a mild cobra rather than a full back bend. Keep the neck neutral. Pull your belly button toward your spine and lightly lift the pelvic floor as if you were stopping the flow of urine. This move combines a front body stretch with pelvic floor contraction. It lengthens tight hip flexors and forces the deep stabilizers, transverse abdominis, and pelvic floor to work together. That improves flexibility, endurance, and neural coordination, all important for sexual performance. Hold for 20 to 30 seconds, breathing deeply. Do 3 to 4 sets with 10 to 15 seconds rest between. As you build capacity, increase holds toward 45 to 60 seconds. Don't hold your breath. Steady oxygen helps muscle function. You'll likely notice better posture, less low back tension, and a stronger connection to your pelvic floor. Get on your hands and knees in a tabletop position. Hands under shoulders, knees under hips. Keep a neutral spine. Exhale slowly and draw your belly button toward the spine while simultaneously contracting the pelvic floor. Imagine gently lifting the muscles upward or lightly stopping urine midstream. Maintain relaxed shoulders and smooth breathing. Hold for 3 to 5 seconds, then release. This trains your deep core and pelvic floor in sync while teaching you to coordinate contractions with breathing. Especially useful for endurance and control during intimate moments. Start with 10 to 15 slow focus repetitions. As your endurance improves, hold for 5 to 10 seconds each and consider slight weight shifts forward or back to stimulate slightly different fibers. Lie on your back with knees bent about 90 degrees, feet hip width apart about a foot from your butt. Arms by your sides, palms down. Find a neutral spine. Press through your heels and lift your hips until you form a straight line from shoulders to knees. The bridge. While holding the bridge, push your knees gently outward as if spreading the floor apart. Then return to center. This exercise recruits pelvic floor muscles, glutes, and hip abductors. A powerful combination. The glutes act as big pumps that help pelvic circulation. The abductors stabilize the pelvis. Together, they support pelvic blood flow and endurance during activity. Do 8 to 12 reps, holding each outward push for 2 to 3 seconds. Keep your core engaged so the back doesn't overarch. Over weeks, increase reps to 15 to 20 and add a resistance band above the knees for extra challenge. Men who stick with this often report firmer erections, more pelvic stability, and less lower back fatigue. Get on all fours again and widen your knees comfortably, feet turned out so your inner thighs open. Lower onto your forearms for a supportive, relaxed upper body position. Breathe deep. Once stable, start rocking your hips forward and back in a slow, controlled rhythm, like a gentle wave moving through the pelvis. This stretch releases tight adductors and deep pelvic floor tension while teaching dynamic control and opening circulation. The rocking motion promotes lymphatic drainage and fluid movement, so blood flows more freely in the pelvic region. Essential for keeping erections strong and reliable. Do 30 to 40 seconds per set, resting 20 to 30 seconds and repeat 3 times. If you're tight at first, don't force the width. Use a pillow under the chest or reduce the range. Over a few weeks, you'll find the stretch feels easier and more rewarding. Many men describe it as unlocking the area and boosting sensitivity and staying power. Put the 5 moves together into a short daily routine. Pelvic tilt, 10 to 15 reps, 3 to 5 seconds holds. Prone lift, 3 to 4 sets of 20 to 30 seconds holds. Tabletop draw in, 10 to 15 reps, 3 to 5 seconds holds. Bridge abduction, 8 to 12 reps. Hold outward push 2 to 3 seconds. Rocking frog, 3 sets of 30 to 40 seconds. Total time about 5 to 10 minutes. Do this daily, ideally at the same time. Many men choose morning or bedtime. Track progress. Note firmness, control, and confidence in a journal. Small daily practice beats sporadic intensity. These exercises don't just build strength, they retrain coordination. Your pelvic floor must squeeze and hold in the right rhythm to trap blood inside the penis and maintain rigidity. These movements also improve circulation, mobilize the hips and lymphatic flow, and clear chronic tension that can act like a tourniquet. Combined, they improve sensitivity, erectile quality, and bladder control. Focus on form, not speed. Quality reps matter. Don't hold your breath. Breathe steadily. Keep nails short and avoid exercises that cause pain. If you have a surgical history, pelvic pain, or significant medical conditions like uncontrolled hypertension or recent prostate surgery, check with your doctor first. If you feel any sharp pain, stop and rest. Persistent pain or new symptoms should be evaluated by a clinician. Be realistic, but optimistic. Many men feel subtle improvement in pelvic warmth, control, and morning firmness within a few weeks. Bigger, lasting changes tend to appear after 6 to 12 weeks of consistent practice. The sooner you start and the steadier you are, the better the results. Hydrate well. Blood volume and circulation matter. Keep regular bowel habits. Constipation and pelvic tension work against you. Add gentle cardio and mobility work to boost overall circulation. Practice mindful breathing and stress reduction. Chronic tension keeps the pelvic floor tight. Combine these exercises with Kegel when you're comfortable. Short, quick squeezes can train fast twitch control for timing during intimacy. This is not a quick gimmick. It's practical training. 5 to 10 minutes a day done correctly and consistently can make a real difference. You're not too old to strengthen these muscles. In fact, they respond remarkably well at any age. Many men regain a level of firmness and control they thought was gone for good. I'm Dr. Hana Kim. Give these moves a try for a few weeks and keep a small journal of the changes you feel. If you stick with it, you may be surprised how much stronger, firmer, and more confident you feel. Share this with a friend who needs it and subscribe if you want more practical, evidence-based men's health tips. You've got this. A few focus minutes a day can change